Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're talking about one of the biggest biologic advances in allergy and immunology, Dupixent. Since its first FDA approval in 2017, Dupixent has transformed the treatment for multiple allergic and inflammatory diseases, with more than 1 million patients worldwide now on this therapy. Although I covered Dupixent once before, the audio at that time was not ideal. Based on your feedback, and with several new indications have been approved since then, I decided to revisit this medication with a more comprehensive and updated review. I should also warn you that today's episode is going to be a little longer than usual because there's a lot of ground to cover. But stick with me to the end. In this video, I'll walk you through 5 key things you need to know about Dupixent. What it is, how it works, how to take it, important warnings and precautions, and its safety profile. And if you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Dupixent and who it's for? Dupixent, also known by its generic name, Dupilumab, is a monoclonal antibody that binds to the interleukin-4 receptor alpha, blocking 2 key drivers of many allergic and inflammatory diseases, interleukin-4 and interleukin-13. This targeted mechanism has made Dupixent an important treatment option across multiple conditions, with its FDA-approved indications continuing to grow over the years. The story begins in March 2017 when Dupixent was approved for moderate to severe atopic dermatitis in adults whose disease is not well controlled with topical prescription therapies or when those therapies are not advisable. In June 2022, that approval was extended down to children as young as 6 months old. Dupixent can be used with or without topical corticosteroids. Next came asthma. In October 2018, it was approved as an add-on maintenance treatment for moderate to severe asthma with an eosinophilic phenotype or oral corticosteroid dependence in adults and adolescents 12 years of age and older. This was extended down to children as young as 6 years old in October 2021. Then, in June 2019, it was approved as an add-on maintenance treatment for adults with inadequately controlled chronic rhinosinusitis with nasal polyps. That indication was extended to adolescents 12 years of age and older in September 2024. In May 2022, it was approved for eosinophilic esophagitis in adults and adolescents 12 years of age and older. This was extended down to children as young as 1 year old in January 2024. In September 2022, it was approved for Prurigo Nodularis in adults. In September 2024, another indication was added, an add-on maintenance treatment for adults with inadequately controlled chronic obstructive pulmonary disease, or COPD, and an eosinophilic phenotype. In April 2025, approval was granted for chronic spontaneous urticaria in adults and adolescents aged 12 and older who remain symptomatic despite antihistamine treatment. This indication was further expanded in April 2026 to include children as young as 2 years old. In June 2025, it was approved for Bullous Pemphigoid in adults. And most recently, in February 2026, it gained approval for allergic fungal rhinosinusitis in adults and children 6 years of age and older who had previously undergone sinonasal surgery. So, as of 2026, Dupixent is FDA-approved for 9 different conditions: atopic dermatitis, asthma, chronic rhinosinusitis with nasal polyps, eosinophilic esophagitis, Prurigo nodularis, chronic obstructive pulmonary disease, chronic spontaneous urticaria, Bullous Pemphigoid, and allergic fungal rhinosinusitis. One important pattern across all of this, like many biologics used in allergy and immunology, Dupixent generally comes into play once standard treatments, such as inhalers, topical medications, antihistamines, are not enough to control the disease. That usually means the condition is moderate to severe, dependent on steroids, or has a specific phenotype that is more likely to benefit from targeted medications. It's also worth noting that Dupixent is not a rescue medication. It does not replace quick relief inhalers or emergency treatments for acute asthma or COPD symptoms or attacks. Instead, it is designed for long-term control by cutting down flare-ups, improving breathing, and keeping disease stable. Second, how does Dupixent work? Dupilumab, the active ingredient in Dupixent, is a monoclonal antibody that targets the interleukin-4 receptor alpha. This receptor is found on many different immune and non-immune cells throughout the body, and it is the shared entry point for 2 important signaling proteins, interleukin-4 or IL-4 and interleukin-13 or IL-13. IL-4 and IL-13 are 2 of the main drivers for type 2 inflammation, a major immune pathway behind many allergic and inflammatory conditions. These proteins promote inflammation, recruit inflammatory cells, and contribute to tissue damage in organs like the skin, lungs, nose, sinuses, and esophagus. By blocking both IL-4 and IL-13 at the same receptor, Dupixent interrupts that inflammatory chain reaction before it can trigger multiple downstream immune responses, helping reduce inflammation, its symptoms, and prevent flare-ups, depending on the disease being treated. This shared mechanism is exactly why a single medication can treat so many different illnesses. Importantly, Dupixent is not an immune suppressant. It's better described as an immune modulator, meaning it selectively rebalances an overactive immune response rather than broadly suppressing the immune system. That precise, targeted approach is part of why Dupixent generally has a favorable safety profile and does not require routine lab monitoring. Third, let's talk about how to take Dupixent. Dupixent is given as a subcutaneous injection using either a prefilled syringe or prefilled pen. The recommended dose and frequency depend on the condition being treated, along with the patient's age and body weight. For atopic dermatitis, adults receive a 600 mg loading dose, followed by 300 mg every 2 weeks. In children 6 months to 17 years old, dosing is based on age and weight, and older pediatric patients may also need a loading dose. For asthma, adults and adolescents 12 years of age and older receive either a 400 or 600 mg loading dose, followed by 200 or 300 mg every 2 weeks, respectively. The dose depends on whether the patient has oral corticosteroid-dependent asthma or other Dupixent-approved condition. In children 6 to 11 years old, dosing is based on weight. For chronic rhinosinusitis with nasal polyps, adults and adolescents 12 years of age and older receive 300 mg every 2 weeks. For eosinophilic esophagitis, adults and children 1 year of age and older who weigh at least 15 kilograms receive weight-based dosing. For COPD, Prurigo Nodularis, and Bullous Pemphigoid, adults receive 300 mg every 2 weeks. However, unlike COPD, both Prurigo Nodularis and Bullous Pemphigoid require a 600 mg loading dose. For Bullous Pemphigoid specifically, Dupixent is started together with a tapering course of oral corticosteroids. Once the disease is under control, the corticosteroids are gradually tapered off while Dupixent continues on its own. If a relapse occurs, corticosteroids can be added back if medically appropriate. For chronic spontaneous urticaria, adults receive a 600 mg loading dose followed by 300 mg every 2 weeks. In children 2 to 17 years old, dosing is based on age and weight, and older pediatric patients may also need a loading dose. Lastly, for allergic fungal rhinosinusitis, adults receive 300 mg every 2 weeks, while children 6 to 17 years of age receive weight-based dosing. I know that's a lot of numbers to take in, but don't worry. Your allergist and immunologist will work out the dose, the interval, and whether a loading dose is necessary. And if you or your loved one has more than one Dupixent-approved indication, your doctor will choose the most suitable dosing plan. Dupixent can be given by a healthcare professional or self-administered at home. The prefill syringe is for use in patients 6 months and older, whereas the prefill pen is for use in patients 2 years and older. For children 12 years of age and older, Dupixent should be administered by or under the supervision of an adult. For children 6 months to less than 12 years of age, a healthcare provider or caregiver should give the injection. Dupixent can be injected into the thigh or abdomen or the upper arm when administered by a caregiver. Rotate the injection site with each shot and avoid injecting into skin that is tender, damaged, bruised, or scarred. If using the abdomen, stay at least 2 inches away from the belly button. Before starting home injections, patients and caregivers should carefully review the instructions for use section of the package insert or on the official website and get proper training from their healthcare team. If you miss a dose, what to do depends on the dosing schedule. For weekly dosing, take the missed dose as soon as possible and begin a new weekly schedule from that injection date. For every 2-week or every 4-week dosing, if it has been 7 days or less, take the dose and resume your original schedule. If it has been more than 7 days, take the dose and start a new schedule from that date instead. Fourth, let's review important warnings and precautions. Hypersensitivity reactions, including anaphylaxis and severe skin reactions, have been reported with Dupixent. If you notice trouble breathing, wheezing, fast heartbeat, fever, general ill feeling, swollen lymph nodes, joint pain, itching, hives, nausea, vomiting, stomach pain, fainting, dizziness, feeling lightheaded, swelling of the face, lips, mouth, tongue, or throat, or skin rash, including rash that looks like a bullseye, painful red or blue bumps under the skin, or red pus-filled spots on the skin, stop the medication immediately and seek emergency medical care. Eye-related issues, including conjunctivitis, keratitis, and blepharitis, have been reported in both clinical trials and after approval, and they happen more often in patients being treated for atopic dermatitis. Most people recover or improve while still on Dupixent, but some have had vision changes, and in rare cases, complications serious enough to require surgery or discontinue Dupixent. If you develop new or worsening eye symptoms like eye pain or blurred vision, reach out to your healthcare provider right away. Depending on the situation, you may be referred to an eye doctor for further evaluation. Dupixent should also be used with caution in patients with significant dry eye disease, history of major eyelid problems or surgery, or previous tear duct surgery. Although uncommon, patients with asthma on Dupixent may develop eosinophilic pneumonia or eosinophilic granulomatosis with polyangiitis, also known as EGPA, particularly while tapering off oral corticosteroids. Contact your healthcare provider immediately if you notice a new rash, worsening shortness of breath, persistent fever, chest pain, brown or dark-colored urine, or feeling of pins and needles, or numbness of your arms and legs. If eosinophilic pneumonia or EGPA is suspected, Dupixent may be paused pending further assessment. Another important reminder is not to stop corticosteroids suddenly after starting Dupixent. Whether taken by mouth, inhaled, injected, or applied to the skin, corticosteroids should only be reduced gradually under your doctor's supervision. Stopping or tapering them too quickly can cause withdrawal symptoms or unmask conditions previously suppressed by corticosteroids. New onset psoriasis has been reported in patients receiving Dupixent, including those without a family history of psoriasis. It can appear from weeks to months after starting treatment and improves or resolves once Dupixent is stopped. Patients who stay on Dupixent may need additional medication for psoriasis. If you notice new skin symptoms, let your healthcare provider know. You may be referred to a skin doctor for further evaluation. Joint pain has also been reported. Some patients had trouble walking or moving because of joint symptoms, and in some cases required hospitalization. Joint pain can begin anywhere from days to months after starting Dupixent. While some patients' symptoms resolved without stopping treatment, others improved after Dupixent was discontinued. Talk to your healthcare provider about any new or worsening joint symptoms. Dupixent may need to be stopped, and you may be referred to a joint specialist for further evaluation. Because patients with parasitic infections were excluded from clinical trials, it is not known how Dupixent affects the immune response to these infections. Parasitic infections were reported in some children receiving Dupixent for asthma, and all recovered with appropriate treatment. Any existing parasitic infection should be treated before starting Dupixent. If a parasitic infection develops during treatment and does not respond to standard therapy, Dupixent may need to be withheld until the infection has resolved. Lastly, be sure to stay up to date with age-appropriate vaccinations before starting Dupixent whenever possible. Because it remains unknown whether live vaccines are safe or effective during treatment, these vaccines should be avoided right before and during Dupixent therapy. There is limited data on non-live vaccines during treatment, so discuss your vaccination schedule with your healthcare provider before getting any immunizations. And finally, let's review the side effects and safety. Overall, Dupixent has been shown to be well tolerated across large clinical trials and real-world studies. Like any medication, however, side effects can occur, and they vary somewhat depending on the disease being treated. In adults with atopic dermatitis, the most common side effects were injection site reactions, oral and other herpes virus infections, and eye problems, which may include eye and eyelid inflammation, redness, swelling, itching, eye infection, dry eye, and blood vision. The safety profile in children 6 months to 17 years old was similar to that seen in adults. In adults and adolescents 12 years of age and older with asthma, the most common side effects were injection site reactions, sore throat, and eosinophilia, which is an elevation in a type of white blood cell called eosinophils. In children 6 to 11 years old, the safety profile was comparable to that seen in older patients, aside from a small number of mild to moderate parasitic infections, all of which responded to anti-parasitic treatment without stopping Dupixent. In adults with chronic rhinosinusitis with nasal polyps, the most common side effects were injection site reactions, stomach issues, joint pain, trouble sleeping, toothache, eosinophilia, and the eye problems described earlier. In adults and adolescents 12 years of age and older with eosinophilic esophagitis, the most common side effects were injection site reactions, upper respiratory tract infections, joint pain, and oral or other herpes virus infections. Children 1 to 11 years old had a safety profile similar to that observed in adults and adolescents. For Prurigo Nodularis, the most common side effects were common cold symptoms, oral and other herpes virus infections, dizziness, diarrhea, muscle pain, and the eye problems described earlier. For COPD, the most common side effects were viral infections, headache, common cold symptoms, back pain, diarrhea, joint pain, urinary tract infections, injection site reactions, nasal inflammation, toothache, stomach issues, and eosinophilia. Clinical trials also reported a small increase in gallbladder inflammation, including a few serious cases in patients on Dupixent. In adults and adolescents 12 years of age and older with chronic spontaneous urticaria, the most common side effect was injection site reactions, and no new side effects were identified in children 2 to 11 years old. For Bullous Pemphigoid, the most common side effects were joint pain, herpes virus infections, and the eye problems already covered. Lastly, for adults and children 6 years of age and older with allergic fungal rhinosinusitis, the safety profile was similar to that seen in patients with chronic rhinosinusitis with nasal polyps. After approval, additional adverse events have been reported through post-marketing experience with Dupixent. Although it is difficult to determine how often these occur or whether they're directly caused by the medication, These reports highlight the importance of stopping the injection and consulting a healthcare provider if new, persistent, or worsening symptoms develop. And there you have it, 5 key things to know about Dupixent, one of the most widely used biologic therapies for allergic and inflammatory diseases today. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.